When shall I have cataract surgery? Hi, I'm Mira, Dr. Neil's assistant at Anaheim Eye Institute, and this is one of the most common questions we are asked every day. There are so many misconceptions around this topic that we thought it would be useful for us to create a video to discuss it. First, remember that a cataract is the natural loss of flexibility and clarity of the lens inside of the eye. A cataract is a naturally progressive aging condition of the eye, and it develops in everyone who lives long enough. The average age for cataract surgery in the United States is 68 years old. There are some things that make cataracts grow bigger and faster, such as smoking, elevated blood sugars, or exposure to medications that contain any steroid in them. But it occurs in everyone. Just to drive this point home, here is a photo of lenses from cadaver eyes at different ages. These individuals donated their eyes after their death. The lens of the eye was removed and photographed. On the top left is the clear lens of a 6-month-old baby who unfortunately passed away, and her parents donated her eyes to research, and on the bottom right is the lens of a 91-year-old patient. As you can see from this clinical study, there is a gradual clouding of the human lens that occurs over time. By the age of 47, you can see the clouding has become significant, and it is around this age that the lens has lost flexibility and patients need reading glasses because of the inability of this lens to zoom in to see close. So that you understand that cataract is the natural age and change of the clarity of the human lens, the real question comes, when should the lens be replaced? That is, when should you consider cataract surgery? The first point in time that cataracts should be removed is when they are affecting vision. The signs that your lens are affecting your vision include glare with night driving, a decrease in the quality of your vision, your glasses not working as well as they used to, and requiring more light to read. If you are noticing any of these symptoms, it is time for lens replacement surgery. However, because the reduction in vision due to cataracts occurs so slowly over decades, many patients simply do not notice this gradual decline, and so we use objective data when we recommend lens replacement. Obtaining objective data involves using highly accurate, advanced technology to study the lens of the eye. In our office, we use the IOLMaster 700, which measures the exact dimensions of the lens using OCT technology, the Oculus Pentacam, which uses imaging to measure the lens clouding objectively, the HD Analyzer, which measures the amount of light that is blocked and scattered light as it passes through your eye to reach the retina for you to be able to see. These technologies help us subjectively evaluate the lens of the eye. These are very advanced diagnostic equipment that are not available at your local optometrist's office. This is why patients will often come to us very surprised, saying things like, "My eye doctor at Costco didn't mention my cataract," or "I was told I had the beginning of cataracts but nothing else." If you have heard these statements before, it really means you need a more comprehensive evaluation with these technologies. The last factor that we consider in the timing of surgery involves minimizing risk. All surgeries, including lens replacement surgery, carries risks of surgical complications. These risks can mean that the vision is made worse with surgery, there is a delayed recovery, or need for multiple eye surgeries. Our goal is to time your surgery to minimize these risks. Remember that the cataract lens grows inside of the eye, and to remove it, it needs to be cut into little parts, and each part is melted by using ultrasound technology. The larger the cataract is allowed to get before it is removed, the more cutting and ultrasound energy is used, and this is what greatly increases the risks of complications. So simply put, the risks of complications increases the older the patient is, and the larger the cataract gets prior to its removal. This is why we do not like to see the cataract grow inside of the eye unmonitored. Thank you for taking the time to watch this video. If you have any questions or feel like you need a thorough evaluation of your cataracts and lens replacement options, we would be happy to help you.